Good morning. Good morning. Let's talk. Let's talk today on Baby Talk about kids that are a little older and that are battling the disease called diabetes. Today's information is shared from the CDC website, and I encourage you to listen carefully because our children do not need to suffer or experience the setbacks that diabetes will bring to them. This is Dr. Yonnette talking with you today on the topic of diabetes. And today we are talking about type 2 diabetes in kids. Type 2 diabetes, that means that the child has acquired the disease. It's not a disease that he or she was born with, as in the case of type 1 diabetes. And in America, there is really a growing problem in regards to our young people and the number of them who are experiencing the disease of diabetes. And what is heartbreaking is that this disease is a preventable disease. It's a lifestyle related disease. And with change in your lifestyle, you can reverse the signs of diabetes and give your child a healthier option. So just recently, only recently, young people and teenagers never ever got type 2 diabetes, which is why we really need to look at what is happening and how we can address this issue. Now, 1/3 of American young are overweight, which is a problem that is very closely related to increasing the chances of type 2 diabetes in your child as young as 10 years old. Let that sink in. 2/3 of American young youth who's supposed to be running around on the field, exercising, moving, eating healthy, are experiencing diabetes or are overweight, which can lead to an increase in the number of kids that end up getting diabetes. Now, weight really does matter. Overweight people, especially if you have excess belly fat, check your child to see where that belly fat is see where the fat is accumulating. Children with excess belly fat are more likely to have insulin resistant experiences. Insulin resistance is a major risk factor for type 2 diabetes. And insulin is actually the hormone that's made by the pancreas, which is like a key to let blood sugar into the cells and to use up that energy. And when there is an insulin resistant situation happening, then your child is exposed or is at risk to developing diabetes. As long as there's enough insulin produced, the blood sugar levels will remain normal. Okay? So insulin resistance usually doesn't have any symptoms, though some kids develop patches of thick, dark, velvety skin, usually in the body creases and folds of the back of the neck or the armpits. There are also other conditions that are related to insulin resistance, which include high blood pressure, high cholesterol, and polycystic ovary syndrome. So let's go back to those patches because I want you to check your child. There are a lot of kids that I see, those folds around the neck where you see those dark patches. Look under the armpit, check your child, and make sure that he or she is not demonstrating the insulin resistant signs like I mentioned earlier. Activities matter. Weight matters. Activity matters. Being active, enroll your child in a sport. It doesn't have to be the traditional school sport. It can be swimming, it can be martial arts, it can be baseball, basketball, whatever it is. Get your child moving. Moving activity lowers the risk of type 2 diabetes because it helps the body use insulin better. It decreases insulin resistance. And the physical activity also improves health in so many other ways, controlling your blood pressure and boosting the child's mental health. Then age matters. Kids who get type 2 diabetes are usually diagnosed in their early teens. So one reason is that the hormones present during puberty make it harder for the body to use insulin, especially in girls who more likely than boys, okay, more girls develop type 2 diabetes than boys. And maybe because boys are moving more than girls are. That's an important reason why you need to help your kids change their health while they're young. Here are some other risk factors that you need to consider. Having a family member with type 2 diabetes, being born to a mom with gestational diabetes, being African American, Hispanic or Latino, Native American, Alaska Native, Asian American, or Pacific Islander, and having one or more conditions related to insulin resistance. These are your risk factors. So if your child is overweight and has two of the risk factors that I just mentioned, talk to your child's pediatrician about getting him or her, his or her blood sugar tested. And then, because testing normally begins at age 10 or older when puberty starts. Whichever one is first, if the child goes into puberty before 10, get him tested or her tested. And you repeat that test every 3 years. Take care. Take care of what you are doing as parents. You can do a lot to help your kids not have type 2 diabetes. Start a new normal for your family. Mothers, you have so much control over what your family eats, your household. Create or try to help your children and dads too develop healthy habits, good habits that will help them, that they will grow into as they get older. Do a makeover for mealtime. Drink more water and fewer sugary drinks. Eat more fruits and vegetables. Make favorite foods healthier. Get kids involved in making healthier meals. Skip the McDonald's every now and then. And keep your kids on healthy meals. Get kids involved in eating slowly and let them sit at the table together with you so it takes at least 20 minutes to start feeling full. Eat at the dinner table and shop for food together. You want to shop where it is or when you're on a full stomach, actually, so you're not tempted to buy unhealthy food. And teach your child how to read labels. Have meals together as a family as often as you can, and don't insist that your child or your children clean or eat everything off the plate. Don't put serving dishes on the table. Serve small portions. Let kids ask for seconds if they need it. But make sure that you are measuring the portions that you're giving to your child. And reward kids with praise instead of food. You don't have to use food. Take them to McDonald's because they did well on their test. And also, lastly, I want you to think of becoming more physical as a family. Aim for your child to get 60 minutes. And I'm not saying your child together. You can get 60 minutes of physical activity a day, and you can break it up, a 10-minute here, a 15-minute there. Walk instead of driving, take the stairs instead of the elevator. Start slow and build up to your tolerance and keep it positive. Focus on the progress that you're making. Take parent and kid fitness classes together. Make physical fitness more fun. Try new things. Ask the kid what activities they would like best so that everybody can do that together. And encourage your kids to join sports at school. Schools offer a lot of sports activity and they vary. So, you don't always have to be in a competitive sport. Have a fit kit available. Some jump rope, some hand weights, some resistant bands, and then you want to limit screen time. I've been talking about this all before. Limit screen time to about 2 hours a week. Plan active outings like hiking and biking. Walk together around your neighborhood. Move in and out of the house, vacuuming, raking leaves, gardening, and then turn your chores into games like racing to see how fast you can clean the house and do other activities. This epidemic, this that we are seeing in terms of diabetes, is really very frightening, and our young children are suffering as a result. So, moms and dads, it's very, very important that you begin to take care of your older children as well. Control the diet, control their activity, and help them have a healthier life, because diabetes is not something that you need to live with. Type 2 diabetes is not something that you need to live with. It's all a lifestyle disease. And so if you change your lifestyle, you'll get better results and eradicate or eliminate the disease of type 2 diabetes. This is Dr. Yonnette thanking you for joining me today and saying to you, take care of yourself as you take care of your baby and your child. Have a great day.